In this video, we're testing our diagnostic skills. Here's how it'll work. I'll present you with the details of a fictional case. Then you'll take some time to figure out what you think the appropriate diagnosis is. At the end, I'll provide you with the correct diagnosis for the case. But first, my name is Keegan. I have a master's degree in counseling and I'm a licensed professional counselor. I make videos like this to help you better understand various concepts in the world of psychology, counseling, and mental health. Keep in mind that engaging with this channel does not constitute a therapist-client relationship. This content is for educational and entertainment purposes. This does not substitute or replace professional mental health care. Today we're reviewing the fictional case of Robbie Lewis. He's a 42-year-old male who was brought to the hospital by his wife. She states that he has a history of major depressive episodes, and at the worst, that these episodes can last months. She says that for years, Robbie has taken mood stabilizers that have helped manage his symptoms of depression. However, she says that he recently quit taking his medication as he had been taking it for many years and had felt as though maybe his symptoms had improved where he wasn't needing the medication to help manage this anymore. She says she brought Robbie in today as she's been growing increasingly concerned about Robbie's condition. She notes how he's been up for basically 72 hours, only sleeping an hour here or there. She also describes how he's been acting erratically, and she says that he's been saying things that she describes as bizarre. She explains that she doesn't know what he means by some of the things that he's saying, and that she's growing increasingly concerned for his safety due to his recent behavior and the changes that she's seen. While you've been meeting with them, you notice how the wife is the one who's been providing all of the background information. While Robbie isn't saying anything, you notice that he's clearly agitated. When you start to ask him information about what's been going on, Robbie explains that he needs to leave the hospital. He says that he's been, quote, receiving energy directly from the sun, end quote, and that he can't get this energy while he's in the exam room as there aren't any windows. At this point, his wife interrupts and says these are the kind of statements that he's been making lately, and that they're very out of character for him. She goes on to say that he spent nearly $10,000 on cryptocurrency investments, and that the amount of money he's spent on this is concerning to her, but also that he's never really expressed any interest in cryptocurrency before this. At this point, Robbie then interrupts, and he says that it doesn't matter that he hasn't been interested in this before. He expands on this, talking very quickly, saying that he's been investing in cryptocurrency because of the secret messages that the person on the television is giving him. He adds that his wife can't understand this because she isn't getting the secret messages like he is. Robbie reiterates that he wants to finish the appointment quickly, that he's needing to go and work on his cryptocurrency investments, but he says that he has something very important to share, but that it's important that nobody else knows. He goes on to explain how he's a prophet, and that if people know this, they might try to stop him from doing the work that he's meant to do. He says that his cryptocurrency investment is going to unlock wealth that the world has never seen before, and that he'll be able to use this wealth to stop all of the bad things from happening. However, Robbie never goes on to explain what the bad things are that he's trying to stop. Before you can respond, Robbie starts with what seems to be a new topic. He starts to explain how he's a Roman Empire who's been reincarnated. During this, his wife interrupts and explains how she is becoming exhausted by all of the different things that he's talking about, how quickly he's talking, and that she can't keep up with what he's trying to say. You ask more questions about the symptoms that he's been experiencing, and you learn that the worst of this has been going on for the last 7 or 8 days. But when his wife thinks back, she believes that his symptoms may have started even sooner than that, roughly about 2 weeks ago. She says that this is when his mood seemed to start increasing, his sex drive went up, and that he's got 2 speeding tickets within the last 2 weeks, which is very unusual for him. Although his wife interrupted, Robbie didn't seem to notice. It seemed as though he got easily distracted by his phone, which he has since been focused on and has been typing on rapidly. Robbie's appearance is disheveled. He is restless, his speech is rapid, his thought process is disorganized, and he appears to be experiencing flight of ideas and racing thoughts. Based on what he's shared, he seems to be experiencing delusions. His mood, according to his wife, has been euphoric and irritable, and his affect while meeting with you is consistent with this. He does not seem to have any insight into his current symptoms, and his judgment appears to be severely impaired. This is the case of Robbie. If you need to go back to review any parts of the case, feel free to do that now, as we're going to discuss the diagnosis. But first, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. As a quick overview, Robbie was brought to the hospital by his wife. He has a history of major depressive disorder and recently quit taking his mood stabilizer after being on it for many years. While on the mood stabilizer, his mood seemed to have been well managed. Currently, it seems as though his mood has been elevated for about 2 weeks, with his symptoms appearing more elevated in the last week specifically. While you meet with Robbie and his wife, he's making statements about how he's receiving energy from the sun, secret messages from TV, and how he's a prophet. Since his mood has increased, he's been speeding more, his sex drive has increased, and he's put large amounts of money into cryptocurrency investments that he says will stop bad things from happening. His mood can be described as euphoric while also irritable. He has slept very little over the last few days, and he's been talking so quickly and changing topics so rapidly that it's been hard to follow him. If you're needing more time to review the diagnosis, now is the time where you'll want to pause the video, as we're going to be going into what the correct diagnosis for Robbie is. Based on what we've gathered here, Robbie meets criteria for bipolar 1 disorder, and it would be appropriate to add a specifier of with mood congruent psychotic features. If you want to learn more about bipolar disorder, make sure you subscribe, as we'll be diving into this diagnosis in the next video. This is the end of the fictional case of Robbie. This case presentation is for entertainment and educational purposes. Any resemblance that this case has to a real situation is purely coincidence. That brings us to the end of this video. I hope that you found it helpful. While you're here, make sure that you check out some of the other videos on my channel. Thank you so much for watching.